Hey all my lovely patients out there. Today's video I'm going to be showing y'all how to exercise properly, how to stretch properly. I get a lot of questions all the time on doc, what can I be doing to better help my shoulder, my lower back that's bothering me when I can't come see you or in between on the weekends. So today we're going to be going over how to do some shoulder exercises for rehab and to strengthen, some lower back exercises, and some leg exercises that will help strengthen them and to help improve your strength, overall flexibility, and hopefully help alleviate some pain in between the visits when you can't come in here. Okay. Alright guys, so today we're going to go over the shoulder exercises that I get asked about a lot in the practice here. These are going to help strengthen your shoulder up, obviously, and can even help when you're getting pain when you're reaching up for things in the cabinet or trying to open a door. These type of exercises will help you to do that a lot easier. So to begin, we're going to start with working the front of the shoulder. Very simply, if you have a band, you'll step on the band, then you'll pick the band up and you'll bring it up. If you don't have a resistance band, then we're just going to use dumbbells. You can use 2 pounds, 3 pounds, 5 pounds. If you don't have that in your house, you can use a beer can, a bottle of water, Coke can, a liter bottle. Get creative if you don't have the weights or the exact equipment you need to do it. So to begin, you'll step on the band, you'll bring it up, or you're pretending you're holding dumbbells, and all you do is thumbs up, and you'll start here, and you just come up to right here to where the arm is parallel to the shoulder, and right back down. Very easy, simple exercises for the shoulder here to work the anterior deltoid. Okay. Next, we're going to work what's called the supraspinatus muscle, which comes along the top of the shoulder blade here and the shoulder itself. You're going to turn your thumbs down, and you're going to split the difference between the front of you and the side of you and kind of go right in between here. So not directly in front, not directly out to the side, but right in between with the thumbs down. This will be the toughest exercise you do. Very simply, you can put the band underneath your foot again or hold your dumbbells, and you just come up in this kind of fashion just like this. Okay, and again, we're going up to parallel, thumbs are down, and this is working the supraspinatus muscle group in the shoulder. Okay. The last one is the lateral deltoid. You just bring the hands out to the side here, and to help you remember it better, thumbs out to the side. So this is called your I's, this is called your Y's, and these are called your T's. The lateral will work the lateral shoulder or deltoid. That's it. Hey patients, so right now we're going to go over how to do the lower back exercise, which is a great way to strengthen your low back to help prevent further injury, and also could even help take away some pain in the process. Very simply, you hold your 5-10 pounds, get your feet and legs together, your hips and knees will be locked in place, and all you do, you just bend forward at the waist and you come down as far as you can. If you can touch the ground, that'd be great. And then you're just going to come right back up. And very simply, you're going to work that lower back, the all the erector spine anchor back there, and help strengthen that up. To go over a couple techniques real quick, when you're coming down, your back should stay nice and flat the whole time. It shouldn't round. See how I'm rounding right now? It should be nice and flat the whole time, and that's how you should be in this form or position when you're doing the exercise. Hey patients, so right now we're going to go over the proper way to do a squat, which will help strengthen up your quads, your hamstrings, your calves, and your butt or glute muscles. So to start with, you want to get your legs about shoulder width apart in a nice frontal stance. After this, you want to kind of keep your head level or slightly looking up. This will help you maintain your balance a little better when you're trying to squat down to keep you in a more evenly playing field. After all that, very simply, you just get in that position, just come down, do a nice squat, and then just come right back up. Okay? To show you from a side view, this is what it'll look like from a side view. Again, legs are at shoulder width apart, head's going to be either looking straight ahead or slightly up. Your arms, I like to have them out for stability, and I'll just come down to it just like this, and just come right back up. Now, as far as how low to go, you want to get to where your leg is basically almost parallel to the floor. If you're not sure, use a mirror, or you're going to feel it in your glute when you've gotten low enough. So you want to get low. So for me, it's about right there, and I'll just come right back up. Now, if you're having trouble or you can't perform a squat just on the regular like that, get yourself a chair right behind you. And what you'll do, make sure it's up against the wall and it's not on a, it's not on a slippery surface. It's really easy to move, or it's really easy to stop from moving. But again, shoulder width apart on your legs. Make sure the chair is right where you're going to be sitting down. And then when you go do the squat, you can just sit down. Okay? When you come back up, just come right back up. Try not to use your hands. Try not to come down. And then when you come down, don't do this, don't do this, don't do this. Just hands should be away from you. And then try to prevent your knees from going over your toes. You just want to stand nice and up like that. Now ultimately, if you're having trouble with that, that's fine. Just have a seat, do one, take a break, come right back up. There's your 1 rep, and you'll continue until you get to the amount that you're trying to build up to. Eventually, I want you to where you're coming down, and you're just touching it so you know how low to go, and you come right back up. Keeping the legs at shoulder width apart, your knees behind your toes when you squat, and your head will be parallel or slightly looking up. Thank you. Hey patients, now I'm going to discuss with you on how to strengthen your abs or your abdominal muscles, which is the antagonist muscle to your lower back. Very simply, you're going to lay on the ground or a table that whichever you choose to. You're going to keep your head straight and take your eyes and find a spot in the ceiling or sky directly above you and focus on that with your eyes. So when you go to crunch and do that abdominal exercise, you're not tucking your chin and you're not leaving your chin too far back. It's nice and straight because you've already found that spot directly above you. Now when it comes to coming up and performing the crunch, patients always ask, well, how high do I need to go? The scapulae back here just has to come off the table or the ground, whatever you're doing it on. Once that happens, you've come up high enough, you should feel a nice crunch right through here on the upper to mid-lower ab section of your stomach. I'll go over the technique next on the table to kind of show you visually on how to do it. I hope this helps you. Alright guys, so this is the ab or crunch section that we're about to go over. One thing I forgot to mention in the last video was if your hands, the closer they are to your stomach, the easier this exercise will be. So the closer is easier. As you get further away, the harder it will become. This will be the hardest position you can put yourself in to do the ab crunch. Alright, so again, when we go to do it, I always recommend you either start your hands with your stomach or here across your chest. Your eyes, you'll find a spot directly above you and keep your eyes focused on that. And then the scapulae just has to come off the table. So here's how the exercise is going to look. Just like that. You can see this part. Once I come up enough, that's all you need. That scapula just has to come off the table. And you can see my head, I'm not doing this number. I'm not doing this number. And I'm not doing this number while I'm opening up my head. Keep it nice and straight with your eyes on a fixed point above you. And you just come up just like this, okay? You don't need anyone to hold your feet or put underneath the couch unless you really want to come all the way up. But to do this exercise for what we're trying to accomplish, this is enough right here. This will be enough to strengthen that up, okay? Hey guys, thank you for taking the time to watch the videos today. Once again, Dr. Saden at Bay Bridge Chiropractic Clinic, here to help you out.